Hi, we made it. It's Sunday and I'm still walking. I was so happy to meet so many of you. I caught a little grief about titling this So Many Positives because for many years in the Dercums community, we felt like there were really not a lot of resources for us, that there weren't therapies, there weren't really any kinds of medicine. And over time, it has changed. I don't have anything to disclose. This is my family. I was supposed to do this to introduce you all to my family members, but I like more the double-breasted suit I had on, so I thought I'd show that off a little bit. And if you look real close, you can see that the bowl that was used in my haircut was kind of crooked. This is my sister Sherry. She's with my niece Bella. This February marked the one-year anniversary of my sister Sherry's death. Sherry had the same types of symptoms that I have, and the same lipomas, the same painful masses, the same cardio issues. Sherry passed away from, Sherry passed away from bile duct cancer. And I've done my best to try to separate these things, but it really is a concern for me and a lot of people with Dercums that we are kind of soaking things in inflammation, and it becomes scary after a while. And I know this is kind of a hard subject to talk about, but Sherry, while she was passing away, she made me promise to come back to Dercums. I had left trying to advocate for us, and Sherry made me promise to come back, and so I have. I started treatment again. I got back on medication. I tried to be more proactive, but I credit Sherry. Many of the people who follow us on Dercums Disease Answers, which is a group I formed, have talked about how many loved ones they have that are struggling. I think that a lot of us who have Dercums have many family members who are also impacted by Dercums. Some of my family, one of my sisters has the classic, I'm not sure you all familiar, but there is a classic component where you have a family member who has 2 or 3 lumps and doesn't have any of the symptoms that we do. But I sure did love Sherry, and I'm glad to honor her in this way. And she was always been a big hero of mine. Her work in advocacy really inspired my work in advocacy. And I'm glad she kind of pushed me into coming back. This experience has been an incredible positive for me. Thank you. I kind of like to do a comparison, how things were 10 to 15 years ago. I think a lot of us already kind of know these things, but Dercums was really unknown. Most of the people that I knew that were starting to talk about this, they were all diagnosed with fibromyalgia. And I'm not even sure that that even applies. I think that even the definitions for Dercums were limited. We had very little understanding. It may not have been because there weren't real answers out there. It may have been that we just didn't know them. We didn't have a way to find them. So now we've gone to having what I consider to be some real success in that we have been able to kind of join a niche community. When I spoke at Nord and talked about Dercums while I was there, I was right beside the people with Ehlers-Danlos. And I think it made a huge impact on me. It's really, I think sometimes we hear about these connective tissue disorders and it's hard for us to kind of get a feel for what's going on. But if you ever get around a group of Ehlers-Danlos patients, and I encourage everyone in here to do that, you will find that some people are profoundly disabled. It's not just some of the hypermobility issues. People are wheelchair bound and the chances of them getting up are slim. I'm not trying to be negative about that. I'm just trying to share their experience. But I think with Dercums, I think one of the positives that we are seeing is that the internet has really changed us. As much as we hear talk about people having negative experiences in social media, I've found it to be exactly the opposite. Now, of course, there are those moments, but we've been able to work through it. Dercums Disease right now is the largest advocacy organization for Dercums on Facebook. Again, there's very little understanding. I think for us, what happened last year was very, very impactful. Because now, people with Dercums can point their providers to actual video and photos of our fascia. I'm not sure, it doesn't seem that impacting him in telling you, but I'm telling you, it is very impactful for us because, rightly or wrongly, we have to support our diagnosis. You can't just walk in the door with a diagnosis of Dercums and expect that that doctor is going to know what to do or that they're going to even accept that Dercums is a disease. But that has changed quite a bit. And I think for us, one of the difficulties we had early on is that I think that people had a tendency to think that this is purely a fat disorder, and it's not. I think that it is rightly classed within fat disorders, but I think as time has gone by, that we are more and more starting to find out that it's probably a loose connective tissue disorder. So, again, in the beginning, 10 to 15 years ago, it was very difficult to find a diagnosis of any kind. Most of us had to travel. I'm thankful that through the grapevine, Dr. Herbst helped me find Dr. Correa in Florida so that I could get a diagnosis. It took me years to find out I had Dercums, and a lot of suffering in those years. And like I said, it's still kind of difficult for us, but we are seeing some incredible things happening. It is still difficult to find a diagnosis, but I wanted to share with you something that I think is very important that is happening right now. We are more and more of people are joining our group who already have a diagnosis of Dercums. And I can't tell you what a big difference this has made. A lot of people take a diagnosis kind of for granted, but in the Dercums community, we have to seek these things out. We have to actively try to find them, and we have to actively try to find them in the midst of having a serious chronic illness. But like I said, it's glad that things have changed. And I wanted to add, and I made sure to write it in here because I want people in our community to realize that now more and more of us, our diagnoses are being supported by imaging. I mean, can you believe that? Does anybody have Dercums? Anybody who has Dercums will tell you that they have seen more normal imaging than you can shake a stick at. It happens all the time. People message me on Facebook crying because they said everything was normal. I'm glad to say through our advocacy work, I think that we have been able to, thanks to Dr. Herbst again, we have the settings now for imaging, which is hugely important. A lot of us, like I said, we had normal imaging results, and there was no explanation. But now, many of us are getting images and they say Dercums disease. I can't tell you how important that is to our community. And I think another thing, and it brings me to a mini announcement, is that, of course, with, I can't remember the young man's name, but the pain types of treatments have changed. It used to be that with Dercums, many of us got heavy loads of opioids. And I don't, we have a rule in the Dercums community that we don't pass judgment on what others do for pain relief, because small measures of relief is such a big deal to us. But I'm glad to say that more of us are starting to think about this more as a local thing. Nobody ever used to think that I could have an injection in or around a lipoma and it could have an analgesic effect. I think it's been kind of an all or nothing approach. Either we cut out everything and come back and see us 3 years when the regrowth has occurred, which it always does. Not always, but a lot of the times. But, I think it's very important now that, like that talk yesterday, there are more options available for treatment of Dercums pain. And we have been able to, there's a company called Neuroquant, and that company uses existing MRI of the brain to help identify things that are harder to identify through the traditional MRI or radiology kinds of programs. We are trying to see, and we have a lot of volunteers willing to allow us to share their brain images. And I think, and the company Neuroquant certainly thought, and still thinks, that maybe we could put together some kind of way to identify Dercums in the brain. And I know for a lot of us, we get a lot of grief about brain fog because people don't think it's real. They think it's something we made up. A lot of us in Dercums have been dealing with ongoing issues neurologically in our brains. I recently had another MRI done, and I have microvessel disease of the brain. And they are saying that what is happening in my brain is the same as they see. I'm a veteran, and so I'm getting these services at the VA. And the neurologist told me directly that my brain looks like someone who has been in combat. Literally, there are black dots all over my brain. I don't agree with them, but they are suggesting that I have a form of dementia. I have deep, deep problems with my memory. I can't remember I could be talking to you or anybody with Dercums, or probably a lot of us with lymphedema, but we could be talking and just completely lose it. We have no idea. I have no idea what we're talking about. But I do think that we are starting to approach the idea that, there may be things that we can do neurologically that we just don't understand yet. And I think the science is going to help us quite a bit. I wanted to take a minute. This is something that one of our members' children made for them. And we use it as a picture on our group on Facebook. And I wanted to, I think you can see, if you can read that someone's child is asking their lipomas not to hate them. I think that's really impacting. It tells you a lot about what we're going through, But I also wanted to make note that something really special is happening in Dercums, and that we've been able to attract some of the organizations and groups that were around in the beginning. Some of the people that made things happen are now joining us. And it was always my hope that we be able to bring in as many of these people and groups as we possibly can. We can dialogue. We can work together. If you have projects that you need help with and you need Dercum patients, I can guarantee you I will find them for you. People every day volunteer to help. What can we do? And, the reason is yes, we want answers for our disease, but, it dramatically impacts our lives, our families. Everything to do with what we do is impacted with Dercums. But, as I said, we started this group 10 years ago, and as it says on the slide, there were two members, myself and Mary. I won't tell her last name, but when we started, it was just the two, and now we're over 3,000 members. And I'm proud to say that it's just not 3,000 members who are joining just to be a part of things. We have documented every person that comes to our group is polled as to whether or not they have Dercums disease, whether or not they have lymphedema, and we know what the results are. The people that join our group have Dercums or suspect that they have Dercums, or thankfully, and which is really happening now, they're providers. I called Linda. I'm sure a lot of you know Miss Linda Ann, and and as we are starting to start our own organization, I thought, and the members of our current board thought, that a lot of what our members are facing are going to be therapies. Right now, there's an opinion that there are no therapies for Dercums. It's not true, but there is that opinion. And in my intention and our intention of focusing on therapies, that was why I picked Linda. Of course, she is well known by all of us, and she always, when I have to refer a patient or one of our group members, she's always the first to try to help us to find a therapist for our members. It's very difficult. But I think it adds to our overall story. I think what Linda brings to us is an understanding of therapeutic services that we didn't have before. A lot of us are receiving therapies, but they're disparate. There's no real plan. And I think what we're finding, and I'm hoping others with Dercums will hear me when I say this, that we are finding that there are ways to set up plans of care. It's not just we're going to take care of that pain. We're going to set up a plan of care to hopefully get you some recovery. And I wanted to take a minute here. There we go. I often sign all of my posts with the symbol of strength with our arm, because for many of us, we have real difficulties with strength in our arms. And I always put a picture of a helmet because it's a battle. It's a real battle for us. We have to look at this as we are taking on not only our families and loved ones, but also we're not sitting around in these unhealthy doctor's offices anymore. If a doctor is not going to help you, we are encouraging people to safely go somewhere else. We have developed a list, and I'm sure probably some of you have seen it, but our list essentially is a way for Dercums patients to refer to each other. Just as the FDRS has done, we are doing the same. And thanks to the FDRS, our list is published. We have developed a database, and we're continuing to develop a database of Dercums-friendly providers. And, many of us, I know this next part is going to be a little difficult, but when I was a child, I had a very traumatic experience. And I can honestly say that the only reason I'm here talking to you today is because I fight. A lot of us in the Dercums community are survivors of some really terrible experiences. I think last year, Dr. Herbst really made a big difference in what maybe some of us saw as a kind of casual talk. But the reality of it is that, we all say we're survivors. And it seems to me that we really are. It's not even a question anymore of just surviving Dercums. We are finding out that a percentage of us have experienced severe trauma of one form or another. And, I'm glad to say, and I hope if I could say one thing to all of you therapists and people who care for people with Dercums, is that, you give us hope. These things give us hope. I know, you've been at this event all weekend, and it's really more about lipedema, but I can tell you for sure, Dercums would not be where we are at right now if it wasn't for the FDRS. I will always be supportive of the FDRS and Dr. Herbst and all of the new people that I am meeting that are dealing with Dercums. We are survivors, but it's not just the generic, we survived. It's actually proven that some of us are actually people who survived incredibly bad experiences at different times in their life. We found that people get Dercums after a car accident. We found people who had accidents and fell, broke a hip, and came back with Dercums. I think there's a lot yet to be understood, but I can honestly say I am deeply proud to be here. I'm really touched by everybody. I know that I can be kind of a quiet person, but I want the therapists in here to know that I have seen directly where people who start getting MLD and compression and maybe the use of a vibration plate, people with Dercums go from being supine all the time to sitting, and then on to standing. And now they're moving. It's happening. Everybody likes to tell us you need to keep moving, but nobody tells us how we're supposed to do that. We have been figuring out for ourselves, and I am just deeply, deeply touched by the amount of interest. I heard that Linda Ann was up with another person. I apologize, I have some difficulty with names. But, they were up at 2 o'clock in the morning, adding Dercums to one of the presentations. These things are incredible. And I hope that all of us get a chance, all of us that are involved with Dercums or who have Dercums or care for Dercums, that we have a chance to experience what we are experiencing here. I know, sometimes I think that people kind of take these things for granted, but I am telling you, there are people out there right now that are paying attention, and they are laying in bed or laying on a couch. And this might be the moment that they try to sit up. I'm serious. People don't realize how disabling our disease can be. I think that I wanted to make sure and end this by, of course, thanking the therapist, but I also want to encourage you. Dercums is not scary. Yes, we hurt. Our lumps hurt. Sometimes when you press our skin, it hurts. But it doesn't mean that we can't get the same therapies sometimes that people with lymphedema are getting. We are finding large populations of people within Dercums that are using these new techniques, especially the one where we have found a way of the compression that is used. Pardon me, I have some difficulty, but the compression that is now being used is being used in a pattern at an intensity that works better for patients with Dercums. Many of us before had experienced compression, and it was really negative. It was painful. It hurts. A lot of us complained about getting sick to our stomachs, severe nausea after MLD. But I want to encourage you to keep trying to help us. Keep providing us with those therapies. We need them. I'm telling you, it is crucial. So anyway, I enjoyed you letting me speak to you a little bit. I know that a lot of us in the Dercums community have a difficult time seeing what positives have happened because, frankly, we're in such desperate situations. I, as someone who has built a community of Dercums and Dercums patients, Dercums advocates, Dercums doctors, Dercums therapists, all of these things have greatly impacted our community. I can't tell you how proud I feel when someone tells me that they got up and walked around. I mean, these things are hard to come by. Our victories are small. But I'm glad you're here. I'm glad I'm here. And I'm glad that, that the FDRS and many people involved in Dercums have realized that, we really need your help. And it's not just, we don't feel good. It's serious. We have chronic, serious illnesses. But, I hope if I can say anything to the people watching this at home and the people in my group, I hope that they will see that there is hope. We are trying. Thank you.